I just kept thinking about what would happen to our patients, what would happen, to my family.
It was also a time of a lot of trauma. I mean, there was a lot of trauma amongst our healthcare workers and our staff.
The entire world was at war with a faceless enemy, unsure of what it was and how to defeat it.
It was daunting, it was exhausting, it was scary, but we wanted to be here because we knew we needed to take care of our patients.
They're the nurses who were on the front lines of a virus the world was just discovering.
We practice based on evidence, that we know what we're doing is based on research and that it works and that we can say, be very confident in the care that we're providing.
They are human just like the rest of us. It was their first time trying to care for patients during a global pandemic.
We were a COVID unit, so it was, okay, we're doing this. And then it could literally, by the end of the day, it could be like, okay, actually, we need to change everything and we need to do this now.
During this time, nurse scientist at Corewell Health, Jennifer Kaiser, says nurses didn't only take on a lot of trauma, but they were unable to maintain a personal identity separate from their professional identity.
When one becomes a nurse, they integrate the discipline into their sense of self and their personal identity. So it really means not just doing nursing, that's your job, but that you identify, I am a nurse, regardless of where I am, regardless of what I'm doing, even outside of work.
Jennifer says nurses were doing the best they could with the knowledge they had, but weren't sure if they could be confident in the new findings and protocol due to the speed in which it was coming out.
For example, vaccine studies, we had to very much trust that everything we've learned about how long it takes to research things and produce these studies, that we were seeing, oh, yep, we've got this, we've got the evidence. We had to trust that. And, that was a little bit tough for nurses.
Jennifer tells me there were mistakes made during COVID, but there was also a lot they were able to take away from the experience that will strengthen healthcare in the long run.
There is a much more significant focus on nurse well-being and self-care, mental health.
We've brought people on site to meet with staff and done a lot of just like debriefing, a lot of group building things to just talk about what we experienced, because a lot of us really do have PTSD from what happened.
In Royal Oak, Megan Daniels, 7 News, Detroit.